Howdy and welcome to another video edition of Remedyland. Today I want to talk to you about pulp polyps. A dental pulp polyp or long-term hyperplastic pulpitis is the inflamed pinkish swollen tissue mass which can be observed increasing into the oral cavity from a wide open area on the external surfaces of the tooth. It might at some point cover up the uncovered surface area of the impacted tooth. The unusual development is not reversible and is not going to be affected by therapy with medications. Typical therapy of a pulp polyp is a root canal along with the positioning of a dental crown over the tooth. Seriously affected teeth may have to be removed, along with a prosthetic dental equipment is employed to bring back the regular look of a person's tooth. Causes of pulp polyps. This kind of polyp is mostly a result of a neglected cavity in a big tooth, for example the wisdom teeth. The pulp polyp is usually located in the main second molar or perhaps permanent initial molar, due to the fact these types of teeth are usually more probably compared to others to be significantly damaged by caries at an age once the apical blood circulation into the tooth continues to be excellent. This indicates it is actually mostly a condition of the very first decade of living, however later on lesions can happen. Extended subjection to the harmful bacteria that develop the cavity leads to the discomfort and swelling of the dental pulp polyp within a tooth. Second typical reasons behind a pulp polyp are a damaged tooth, an absence of dental filling or perhaps a missing dental crown. The characteristic of a dental pulp polyp can range considerably. It could be silky, smooth and spongy or perhaps knotty. A pulp polyp can vary in coloration from a whitish pink color to an intense red color. Usually, the swollen pulp polyp might be noticed pushing from the exterior of the tooth from just one or perhaps carious lesion. The lesion reveals like a bleeding mass of granulation tissue developing from the bottom ground in a tooth with most of its own dental crown damaged. Surface area ulceration can occur as greater white-colored or perhaps the surface area might be the identical coloration and look like the adjoining mucosa. Palpation frequently leads to minor bleeding and there is not any discomfort related to it. Periodic situations display polypoid granulation tissue swelling towards the outer area from a considerably small carious damage. Dental pulp polyps are not generally really unpleasant. The majority of the discomfort felt by an individual using this type of kind of polyp is brought on by the tension on the around gingival tissue mass resulting from the development. Direct tension on the polyp usually creates a really gentle pain. Pulp polyps possess one more distinct characteristic. Compared with almost all afflicted and swollen tissues, the pulp polyp of the tooth will not necrotize or perhaps die, when the contamination gets worse over time. The cracking open in the tooth's exterior enables the pulp polyp to carry on and expand. Dental pulp polyp is usually nicely provided with blood and without enclosed space to limit the development of the polyp. The tissue mass will not wane. Furthermore, the harmful elements that cavity leading to harmful bacteria generates are not captured within the tissue mass, which permit the pulp polyp to develop uncontrolled. Pol Polyp Treatment. The pulp polyp is remedied by curating the new connective tissue mass from the pulp holding cell and also carrying out endodontic therapies on the remaining tooth root structures, assuming the interarticular ground remains undamaged. Extraction can be an accepted remedy alternative. There is absolutely no malignant change and the lesion is not going to automatically regress. Leaving a pulp polyp without treatment can lead to a number of problems. Contamination of the adjoining gingival tissue mass and also abscess could appear. The harmful bacteria might spread to additional healthy teeth leading to other cavities to create, leading to the requirement for more dental treatments. Finally, the teeth might end up being too affected to restore and the impacted teeth might have to be removed. I hope you've enjoyed this video edition. We'll see you again on another video edition of Remedyland. Take care.